How's it going, guys? So this is a quick high yield question for pathology for USMLE Step 1. Very valuable. I did not make this a long, rambling paragraph to waste your fucking time. All right, we're going to cut to the chase here. But before we get started, I actually will be a quick asshole and tell you to subscribe to my channel. I really appreciate it. Give the video a thumbs up. Really appreciate it. Find me on Instagram at melman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now, hopping into the question here. We have a 44-year-old dude who has a 2-month history of dark urine and blood-tinged sputum, or dark urine being hematuria. Our renal biopsy is showing us linear immunofluorescence, characteristic of Goodpasture syndrome. Now, what I'm not going to do is spend 24 minutes talking about all sorts of associated conditions and mechanisms that could be confused with Goodpasture. We could go on a lengthy discussion. I'm going to stay concise here. So Goodpasture is classically 2-3-4, 2-3-4, 2-3-4. The Goodpasture is marching through the field. 2-3-4. Sounds fucking stupid, okay? Type 2 hypersensitivity against the alpha 3 chains of type 4 collagen, all right? So we have antibodies against type 4 collagen, or anti-GBM, glomerular basement membrane antibodies, which causes our pathology here, okay? So you have type 4 collagen in the alveoli as well as in the kidney, which causes hematuria and hemoptysis. Questions asking which one of these answers is also a type 2 hypersensitivity, where you have antibodies against your own cells, receptors, etc. So looking at our answer choices, choice A, anaphylaxis, wrong fucking answer. It's a type 1 hypersensitivity. So you can have an antigen such as from a bee sting or a peanut. It binds to IgE on the surface of mast cells and basophils. The IgE come into close proximity. They cross-link. Mast cells and basophils degranulate, release histamine. You get low blood pressure, facial swelling, etc. Wrong fucking answer, okay? Choice B, contact dermatitis, type 4 hypersensitivity, also the wrong answer. This is classically nickel. It can be rubber, poison ivy, poison oak, poison sumac, okay? So that's contact dermatitis. It's a T cell response. That's what type 4 hypersensitivity means. Contact dermatitis will take a few days to present itself as vesicles, and then a few days to go away when you remove the offending antigen. For poison ivy, poison oak, poison sumac, they want you to know linear rows of vesicles on the skin, okay, from contact with weeds, brushing up against the weeds. Very high yield. Also sunscreen, contact dermatitis. Choice C, heparin-induced thrombocytopenia, is our correct answer. Okay, so it's type 2 hypersensitivity where heparin is administered, and it can induce the formation of antibodies against the heparin platelet factor 4 complex. Okay, so heparin PF4 complex, and you need to know it's a type 2 hypersensitivity. Okay, we're making antibodies against one of our own cells / receptors / tissues. Okay, our platelets are our own cells. So lots of different type 2 hypersensitivities we can talk about. Graves' disease, pernicious anemia. Okay. Choice D, serum sickness, wrong answer. This is type 3 hypersensitivity. Okay, this is going to be when a drug is administered and a patient gets arthritis 3 to 7 days later. It can also be a vaccine such as Moderna, okay, colloquially Moderna arm, where the vaccine is given and 3 to 7 days, arthritis. Serum sickness can also be due to infection such as Hep B, Hep C, rubella, chlamydia, reactive arthritis. Okay, so arthritis 3 to 7 days later, that's serum sickness, okay? So you need to know your immunology alongside high yield path, and so high yield conditions for step 1. Okay, very concise question here. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.